Mixed reaction to a video clip showing Limpopo Health MEC Dr. Phophi Ramathuba saying healthcare facilities in her province are struggling to cope. She told the patient that the backlogs are being exacerbated by an influx of foreign nationals. So before we start with the conversation with the Deputy Health Minister, Dr. Sibongiseni Dhlomo, let's listen to this video that has since gone viral.
Instead of using the budget for what it's meant for, I'm operating for what Munangagwa is supposed to do. And that is why when my people of Limpopo want health services, they can't get. And that is angering the community. Because you are coming here to, I was in George Marcel. We are busy operating Mozambican national everywhere. And you are not even registered anywhere. You are not counted. You are even illegal. And you are abusing me. This is unfair. It's unfair. I can't go to Zimbabwe and get health care. Do you think they can allow to operate me?
Let me bring in Dr. Dhlomo. Dr. Dhlomo, good evening. Thanks for your time tonight. Firstly, what did you make of the MEC's comments, response to that particular clip that has gone viral?
Good evening, Katie, and good evening to your viewers. Firstly, let me just apologize that we have come in a bit later than we had expected as media to respond. Minister Pasha is out of the country, and I was therefore consulting with the acting minister, Minister NG Motsecha, to then craft a statement that we have since released. Katie, we don't have a full context of the video clip and what actually was happening between the Dr. Ramathuba and the patient. However, we do actually acknowledge that our health system in the country is overburdened in some areas by the service that we do give to our citizens, also including the asylum seekers and the refugees. Over and above that, then there are undocumented migrants that we need to also give from the neighboring countries. But even there, including in our NHI, we are talking about providing primary healthcare services free to all citizens, including asylum seekers and refugees. We are still checking whether we should or should not give it to also undocumented migrants, but that is another side. This particular incident, it looks like it was just more than primary healthcare provision. Now, one wants to say Limpopo being one of those provinces affected, yes, we actually acknowledge that. However, we would wish that the debate could have happened at another level, as it is continuously happening at bilaterals and multilaterals within SADC. It probably is not really at an appropriate level between a healthcare worker or a doctor to a patient at that level. But however, we are gathering all the facts. Hopefully, when the minister comes back in 2 days' time, we'll be able to report, and then we probably could take the matter forward after that.
Dr. Dhlomo, based on the fact that the MEC holds a political office, so she does have access to raise the issues that she did with that patient through government structures and any other bodies that she may be part of as being a minister. Do you think it was right for her to confront that patient who's lying in a hospital bed in that way?
Like I'm saying, Kathy, the debate is ongoing and probably also at the bilateral and multilateral. I've actually indicated to you that probably it might have been an inappropriate space for that discussion to be between the healthcare worker and the patient. We would need to take this up as we continue to do so, and our minister is leading the process in terms of this, because what Dr. Phophi Ramathuba was raising is issues that we are seized with. It's just that we are not really at the level of being able to make inroads in terms of neighboring countries. Patients and clients do walk across the borders because they see a better service elsewhere than where they come from. But then we need to actually be able to say, how do we deal with that process? I'm saying it probably was inappropriate to be happening at that level, the discussion. We would have to really improve on that.
There's also a question of dignity here and the levels of dignity that can and should be afforded to patients across the spectrum. And this is really not getting into whether or not one may be in the country legally or illegally, as was said in that clip?
Kathy, other countries are very brutal. The US is one of them. Canada, they actually give you Panado. If you need more than that, they just don't do. So we are not even that inhuman at that level. But I'm saying these are discussions because we have not grappled with that. All I'm saying that those issues should be at the policy level finalization and should really be done at that level and probably not get them to the level where it was at a patient over a side bed. I mean, on the bedside with the patient there. So that part, we would wish it would not have happened, but at another level where we are engaging. But actually, undocumented migrants in the world, most countries have a bit of a challenge with that. We probably need to deal with that at the policy level as a country, as it is happening in other very mature democracies. In Canada, in US, you just don't get any help. They just say, thank you very much, go home.
Of course, the concerns that the MEC was raising around issues of budget are very legitimate concerns. How is the Health Department going to be taking that up? She references the Zimbabwean president specifically around the fact that he should be contributing to supporting the primary healthcare sector, especially in Limpopo, given the high influx of migrants there.
Kathy, I think you should remember this, and I hope I'll come back to you again to say, while you are really complaining about our health services in the country as being some of the people in the media say it's a crisis, there are people out there in the neighboring countries that they think we have the best of the best. I mean, they can't have what we have. So we are correct. We need to, at the diplomatic level, complete and conclude that information to say, is either the neighboring countries improve their level of service to their citizens, or then while we are assisting them in this regard, there must be a level of discussion, how do we get compensated? Because, of course, the Treasury will allocate as per the states, South Africa, citizens of Limpopo, citizens of Gauteng, being the two provinces that are heavily burdened by this migration. So we actually need to improve on completing our bilaterals and multilateral discussions on these issues.
Dr. Dhlomo, very briefly, there have been calls for the MEC to be fired. As it stands, will there be any action taken against her?
Like I did say to you, we are really, all of us, looking and listening to that video clip, what we don't have a full context on. We are going to be gathering all the facts in this regard, and the minister will actually be coming back into the country in 3 days' time, and the Minister Motshekga will then fully report to the minister her findings, and we'll take it from there.
All right. Deputy Health Minister Dr. Sibongiseni Dhlomo.